What does a Parkinson's tremor look like in the early stages? Have you ever wondered what a Parkinson's tremor looks like in its early stages? Understanding this can be crucial for recognizing symptoms and seeking help. Parkinson's disease is a progressive neurological disorder that impacts movement, and one of its most notable early signs is a tremor. In the early stages, this tremor usually appears as a slight, rhythmic shaking. It often occurs in the hand, finger, thumb, or chin. This type of tremor is known as a resting tremor because it happens when the affected body part is at rest, not engaged in any activity. For instance, you might notice your hand shaking while sitting quietly, but the tremor often lessens or disappears when you use your hand for a specific task, like reaching for something or shaking hands. A classic example of a Parkinson's tremor is often described as pill rolling. This is when the thumb and forefinger move in a circular motion, as if rolling a small object between them. The tremor can also involve movements called supination and pronation, where the hand rotates, causing the palm to face up and down repeatedly. While the hands are the most commonly affected areas, early tremors can also occur in the legs, jaw, or lips. Typically, the tremor starts on one side of the body and may remain more pronounced on that side as the disease progresses. Some individuals report feeling an internal tremor, which is a sensation of shaking inside the chest, abdomen, or limbs that may not be visible to others. This internal feeling can be distressing, but it is recognized as part of the range of symptoms associated with Parkinson's disease. Several factors can influence how a tremor appears in the early stages of Parkinson's. For example, fatigue, stress, or strong emotions can make the tremor more noticeable. It is important to note that not everyone with Parkinson's experiences tremor. The presence, severity, and progression of tremors can vary significantly from person to person. It is also essential to differentiate Parkinson's tremor from other types of shaking. Normal shaking can happen after exercise, due to stress, or as a side effect of certain medications. However, a persistent, unexplained tremor, especially one that occurs at rest, should be discussed with a healthcare professional. Recognizing a Parkinson's tremor early is vital because it can lead to earlier diagnosis and management. While tremor is a hallmark symptom, Parkinson's disease includes other motor and non-motor symptoms, such as muscle stiffness, slowed movement, balance issues, changes in handwriting, and loss of smell. These symptoms may appear around the same time as the tremor or even before it. If you or someone you know notices a new, persistent tremor, particularly one that occurs at rest, it is crucial to consult a doctor. Early evaluation by a healthcare provider specializing in movement disorders can help determine the cause and guide appropriate care. Only a medical professional can diagnose Parkinson's disease, as other conditions can cause similar symptoms. In summary, a Parkinson's tremor in the early stages is typically a mild, rhythmic shaking that occurs at rest, often starting in one hand or finger and described as pill rolling. It may lessen with activity and can be influenced by stress or fatigue. Recognizing this symptom early, along with other possible signs of Parkinson's, can lead to timely medical attention and better management of the condition. Always seek personalized advice from a healthcare provider for any concerning symptoms.